It's not just some old white guy bending over, holding his knee or grabbing his elbow. We have to look and sound like our patients. We need diversity, and I don't want to focus on the guy that's bent over holding his whatever body part. Instead, it should be authentic, and it should resonate with the patients.
Yeah, that old white guy in the blue shirt.
I see him all the time.
That's walking on the beach. He gets around.
He really does.
He's everywhere.
He really does. I see him on billboards. I see him everywhere.
Yep, I saw him on the YouTube page earlier.
So did I.
Yeah.
The whole family. Yeah. I like know that family. I see
know.
them constantly.
Yeah.
Hey there, welcome to the Dr. Marketing Tips Show. I am Jennifer.
And I'm Corey.
And today we're going to continue our series, our three-part series about managing your practice and getting through these turbulent times from a marketing perspective.
Yeah, and so today what we wanted to talk about was how can you build a transparent, trustworthy practice as the world around us continues to shift and just be in a general state of tumult.
Yeah, and I think that that's important to pay attention to, because great marketing starts with building that kind of authenticity and that trust with your patient. So if your website looks like a prison or is like colors that aren't modern or doesn't give that feel, that warm and fuzzy feel, how do you expect patients to get that warm and fuzzy feel when they show up at your practice?
Yeah, you need to walk the walk, talk the talk, that whole thing. And if you ask patients too, what do you dislike most about healthcare now? You're going to get a couple of different answers, but they're all, relatively going to be the same thing. Well, it's going to be the wait times, it's going to be the convenience or access, pricing, not understanding that what I'm actually paying is a common one, bedside manner, those kinds of things. So, one thing you can do in terms of trust building and transparency, and we've seen a move towards this in orthopedics specifically, is price transparency. There's a stat here I wanted to read that said that 90% of Americans support strengthening price transparency requirements in healthcare. And so what we've seen from a lot of practices that we work with is they're just being very upfront, and they're offering self-pay bundles and self-pay packages, specifically in orthopedics, to go along with this trend and build that transparency.
Well, I think that there's, you've got like No Surprises Act and just the, what that means to having to educate and communicate with patients. I'm of the age where, I have to go to the doctor a little more often, or my mother who lives with me, she goes to the doctor all the time. And what I hear from her is, why do they need to have an appointment with me in order to read my blood work? Why can't that be telemedicine? Why can't? Mm-hmm. I'm inconvenienced, and it's really a lack of trust between the patient and the provider. And it's not the provider, it's the practice. And so even in that case, if somebody were to just tell her why it is, or how the billing practices work, or what she could expect, that trust level would go up, and all of a sudden she'd be, she'd be the raving fan for the practice and the provider, versus what she is now, which is they just want my money.
Right, exactly. Yeah, I was going to say, which is when you said what she is now, and I was going to say confused.
Very confused.
Yeah, and
annoyed.
And then with the lack of communication, she's just making up her own.
That's exactly the case.
Answers or assumptions, which anybody would do in that scenario. So yeah, I think there's two things that I think are worth talking about here. One is being proactive about that communication. So there's a couple different ways you can do that. What we find kind of works the best is having an FAQ section on the website.
Yep.
And continually building that out. I was actually meeting with a surgery center earlier today, and we were going over their website, and we got to the FAQ section, and she was like, well, we don't do it this way anymore. This is wrong, this is wrong, this is wrong. And I said, well, I hate to tell you, but that's all on your website now. That's where all those forms came from, and you haven't updated that, I don't know, in the past 10 years, maybe? I don't know when the last time you updated it was, but you need to give me all that new information. And then I think we take that and we build on top of that to answer some of these real questions that patients are having. So I think that that's one takeaway you can implement very quickly to build trust, because all that is answering the questions that you guys are answering already.
That's right. And I mean, it could be as easy as like pulling back the curtain. We don't know what your bill is going to be, because every negotiation and contract with the insurance company is a little different, but this is how the process works. Mm-hmm. It's just, I think patients and just consumers in general, expect a higher level of transparency and are willing to be educated at this point. So if you can educate, the more you can educate, the more information you can provide, the more empowered those individuals will feel to choose your practice.
Well, yeah, and even if you're totally honest and you say, look, the good faith estimate is $400. Well, when you're in there, if we need an extra implant or whatever, well, it's going to go up. Like, there's nothing we can do about that. And I think if you're upfront about that, then me as a patient, I would say, okay, well, at least I'm prepared to, like, when I'm there, this could change, rather than thinking the other.
Another example, we've heard this before many times. The doctor is 2 hours late.
Mm-hmm.
And
heard that today.
Heard it today. A lot of times, the doctor's 2 hours late. But why? Is it because the doctor went and got coffee and screwed around this morning and stayed at the gym a little extra long, or just decided to go play a round of golf and kept you waiting? Probably not. The doctor's usually late because they're spending too much time with patients. A patient had something complicated, so they're going to give you equal amount of time when you come in, and they're going to give you undivided attention. Maybe they were in surgery this morning and the surgery didn't go well, or they were at the hospital doing rounds. But educating patients as to why they're sitting there waiting and letting them know when their time is up and it's time for them to come back, that they're going to get the same level of treatment, that goes a long way.
Yeah, and how can you do that? I think a couple ways are educating before the patient gets there. So as you're sending out your new patient paperwork, also include some information that says, look, here's what's going to happen the day of. Even if it's just a regular appointment, this may happen and here are the reasons why. If you have lobby videos, you can also include that message on the videos to say, hey, if you're sitting here and you're reading this, here's the reason why you actually might be seeing this message. You can have something on the website. You can have the doctor actually film a video, which, it may be harder to do to get the doctor to film the video. But if you can do that, he can say, listen, I try and run on time, and I'm going to be very honest. Sometimes that doesn't always work out. Here are some of the reasons why, but I want you to know when you're with me, I'm going to give you my undivided attention, and use that as a marketing tool.
I think that's a great idea. And I think we're kind of harping on this trust building as one area, but the fact is like we live in a time right now where radical trust matters, and everything's very transparent. And transparency in pricing, transparency in reviews, transparency on everything. And so if you're not on that train, it's going to leave the station, and the consumer and the patients are expecting that level of transparency.
Yeah, I mean, we talk a lot about how the consumer of today, the healthcare patient, is more educated than they ever have been in the past, and transparency plays right into that, because if you're not being transparent, because they are so savvy, they immediately start to scratch their chin and say, well, why don't they have the answers for that? They must be out to just get in my pocket.
That's what my mother says.
Exactly.
That's what she thinks. And okay, so along the lines of transparency, like the next piece of that is authenticity. Mm-hmm. Because you can't, when you're transparent, to whatever degree that is, you're also being authentic.
Sure.
And so we had a meeting today with a client, and they said, they want to update some of their social media. And they said straight up, I want pictures that actually resonate with the practice and not all these stock photos. And you were coaching them along, and you said, you mean you want transparency and authenticity? And she said, absolutely, that's what I want, because that's the message, and that's how you create a brand for your practice, through that authenticity.
Yeah, and it starts with the providers and the team, and then it also extends to the imagery that's on the website and the patients that you're showcasing. I think there's so much power in that authentic patient testimonial, because then as a viewer, I see myself as that person. They had the same struggle that I had. They got back to doing what they love. I want that. Mm-hmm. And that's so much more powerful than just, a picture of, let's say, a close-up of someone's knee and they're holding their knee. Well, yeah, I get it. My knee's in pain, but that doesn't actually tell me anything.
That's right.
So what is the story we're trying to tell? And when we're authentic and we're clear in that, I think it just sort of inherently, it builds that trust.
It does.
Without saying anything additional. And then if you layer in the messages on top of that, the region's most trusted knee surgeons, or whatever the case may be, whatever your brand is, it just amplifies that.
So here's an example, and I haven't told you I'm going to ask you this question, but you get it all the time. So one way to build trust is, you want what you're seeing on the website or you're seeing in the video to be real. So when a doctor says to you, I'm going to do all these videos, what should I wear? What do you typically tell them?
Wear what you normally wear. Don't go out of your way. Don't look any different. Don't try and be someone you're not. It's one of the reasons when I do a lot of videos, I like to hit record and then start having a conversation, because then I can have a real conversation with someone. Whereas, you know, some providers, they could be the zaniest, off the wall, friendliest provider, and then you turn the camera on and suddenly she is
just a robot.
Oh, she's a robot, exactly. And if we can get the real provider, the real personality, the authentic personality, we're going to do a lot better.
Yeah, and like we were saying, authenticity and trust are, you know, top of mind for everybody. Whether they're talking about it or not, you're seeing it in reviews. And so you have to put forward the same, you know, the same foot that you put forward, that comes forward in the reviews, has to be what people also see on the website, et cetera, et cetera.
Yeah, and so exactly, and that extends to your online resources, so your forums, your chat, your FAQs, whatever the case may be. If you have the price transparency, that makes sense there too. Anything you're doing on social, your brand itself, because again, you want to say without saying it who you are and what you provide, and a good brand will do that. And if you don't have a good brand, well then you just look and sound like everybody else, and that's when you see, you know, the picture of, you land on a competitor's website maybe and you see a picture of a building or a picture of close-up of a knee or whatever the case may be, and that's just, it doesn't communicate the right message. And when you start there, it's much harder to then build that trust and be transparent.
You know, in that meeting we just came out of, we were talking and we were doing like a brand discussion, you know, getting ready to come do some videos and things like that for them. And they were talking about stock footage, right? So I ran over and was checking out their YouTube page. I was checking out the website. I was checking, and I was like, oh, I've seen that picture on another website. I've seen that picture. I know that tagline. I know that. Like, they're all the same. Mm-hmm. So if you really want to be, like, if you want to build trust and you want to be authentic, then, you know, make that effort to get the photos that are actually yours and not just this. I give a hard time to our team sometimes. I'm like, it's not just some old white guy bending over, holding his knee or grabbing his elbow. We have to look and sound like our patients. We need diversity, and I don't want to focus on the guy that's bent over holding his whatever body part. Instead, it should be authentic, and it should resonate with the patients.
Yeah, that old white guy in the blue shirt.
I see him all the time.
That's walking on the beach. He gets around.
He really does.
He's everywhere.
He really does. I see him on billboards. I see him everywhere.
Yep, I saw him on the YouTube page earlier.
So did I.
Yeah.
The whole family.
Yeah.
I like know that family. I see them constantly.
Yeah. So I think, you know, to kind of put a bow on this, when it comes to trust building, the way to start is, you know, just look inward. I think look at the practice itself and look at your team and your providers, because and this is kind of a different topic, but it's still related. A lot of people, they struggle with creating whatever this identity is going to be. And then if you go and you look at their social media, it's just a bunch of stock photos, or maybe it's headshots, and it's just sort of all over the place. But, you know, if you really want to start building trust, and you mentioned it earlier, just kind of, you know, take the veil off, give a peek behind the curtain. Be yourself. And once you can start to do that and you start to develop your voice, everything else will sort of come naturally. So if you start there from a social standpoint, I think you're on the right path. From a website standpoint, my big takeaway would be answer the questions you're gonna get anyway. You know, you don't have to make a big push about it, but just have it on your website, and then you'll be amazed at the amount of time you'll wind up saving because of that, and the trust that you build because of that. And hopefully you're also providing great service, you're building great reviews, and all those things kind of coalesce and come together, and that's how you build that transparency.
Yeah, and this is kind of wrapping up, you know, a 3-part series that we're talking about how do you manage your marketing, grow your practice when we have so much turbulence in the water right now. Mm-hmm. And, you know, to kind of wrap it up here, you know, really the biggest and the easiest thing that you can do is be authentic as a practice, be authentic as a brand, and be okay kind of like pulling the curtain back and being transparent. There's a reason the laws have changed to allow for price transparency and the No Surprises Act and everything else. So there's no reason to bury all that down in your messaging. Lead with it, because I can promise you your competitors are not doing it.
Yeah, exactly. And that, I mean, it takes us right back to the top, to part 1, where we said anchor your brand. This is what we were talking about. You anchor your brand this way, and then that's going to help you do the rest of the list. Optimize your digital marketing, understand and embrace AI, and then all of a sudden, you're building that trust.
There you go. So with that, I'm Jennifer.
I'm Corey.
We'll see you next time on the Dr. Marketing Tips Show. Thanks guys. If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.